there, my name is Shamim, and today I am going to talk about seizure in children. So what are seizures? Seizures are uncontrolled firing of nerve in the brain. If involving both cerebral hemisphere, it is generalized and it will affect the whole body. If involving only one hemisphere or one area, it is focal and affect one extremity or one area of the body. In young infants, seizure can be very subtle and look very different to older folks. They can be just a little movement and sometimes they missed by the doctor or parents. Seizures are characterized into two, which are generalized and focal. Seizures are different depending on where they are in the brain. Frontal lobe seizure may result in bizarre behavior. Temporal lobe seizure may cause depression or mood affect changes. And generalized seizure are expected to have predominant effect in motor movement. In generalized seizure, the types are absence, tonic-clonic, clonic, myoclonic, and in focal seizure, the types are frontal, temporal, occipital, and parietal lobe. Alteration of vital sign and respiratory suppression are also possible, and after seizure, there will be a period of sleepiness that always happen in generalized seizure. Also after seizure, patient may develop a paralysis on one side of the body. Patient will report that they feel absolutely lousy after a seizure. So generally, we know that seizures are no fun to have and it is best that if we can prevent it. Next part of the video will show you the types of seizure and how to manage it. Hello, I have a question regarding my child's condition.
Hi, sure, I'm happy to help.
Why do you think that this seizure occur?
Seizures can happen to various reasons. They can be provoked or unprovoked. Provoked, it can be due to fever, hypoglycemia, or CNS infections. Unprovoked, it can happen spontaneously without any known proximate cause.
Actually, I don't know if this is the first time that he had a seizure, but this is the first time ever that I see him having seizure. In the meantime, so what do I need to do if he has another seizure?
When a child has a seizure, first thing to do is to stay calm. Remove the hazardous objects from the patient's surrounding. Place a soft object like a pillow or a blanket under the child's head. Note down the time or record it using your phone. Call an ambulance if the seizure is over 5 minutes long. Put them into a recovery position once the seizure has stopped. What not to do when a seizure occurs. Do not place any objects in the child's mouth. Do not try to feed the child while seizing. Do not force wake up the child.
So how do you diagnose a seizure? And how do you treat seizure?
Since there are different types of seizures, the treatment varies. If it is a first-time occurrence, the treatment may be unnecessary. But if it's a recurrent type seizure, appropriate therapy should be initiated by the patient's physician after taking the patient history and doing lab results and imaging studies and confirming the diagnosis. Absence seizure causes a short period of blanking out or staring into space. Like other kinds of seizures, they are caused by a brief abnormal electrical activity in a person's brain. Ethosuximide can be prescribed as a first-line agent amongst other medications. Generalized tonic-clonic seizures, also known as grand mal seizure. It gets its name by its two distinctive stages, the tonic stage and the clonic stage. In the tonic stage, your muscles stiffen, you lose consciousness and may fall down. In the clonic stage, it consists of rapid muscle contractions called as convulsions. Tonic-clonic seizures usually last for 1 to 3 minutes. If the seizure is longer than 5 minutes, it's a medical emergency. It's commonly treated by a drug called carbamazepine, among other first-line agents. Lennox-Gastaut syndrome is a severe condition characterized by recurrent seizures that begin early in a child's life. The most common seizure is tonic seizures, which causes the muscle to stiffen uncontrollably. These seizures typically occur during sleep. They may also occur during wakefulness and can cause sudden falls. A first-line agent that is typically given for this type of seizure is called sodium valproate, but multiple agents can be necessary to control the condition. Medications for seizures must be prescribed by a physician. For more information about the child's seizures and their medications, please go see a doctor for them to choose appropriate therapy and how to manage it.